Good morning vlog, happy Monday. We are still on our OB rotation. I have some egg-which sandwiches that I'm gonna be eating for breakfast. Because last time I was in the OR, we did not get a lunch break. I did not eat breakfast, I was starving. And I think my tummy was growling during surgery, so that was a little embarrassing. Hopefully I can stay a little bit more full with this. We have 3 cases on the agenda today. I think we have 2 colpal cliases. I don't know what the plural for a colpal cliasis is, but we have 2 of those, and it's basically a procedure that fixes very severe uterovaginal prolapse. And after then, I think the 3rd case, can't remember off the top of my head, but we did some reading on our patients, also reading on the procedures, just knowing the general indications, contraindications, complications, any allergies the patients might have. And yeah, running on time, but I gotta leave soon, so I will see you guys there. Alright guys, we just got out and we had a bit of a disaster this morning. I went to the wrong surgery center because I read the schedule wrong. Went to the surgery center I was supposed to go to today. So almost missed the first case. I was so nervous because it was my first day with this team. They were very understanding. I got to put in a Foley catheter for the first time and did so for all 4 surgical cases today. Efficiency wise, 4 cases before 3:30, I'd say pretty good. So now gonna go eat some lunch because did not eat anything since this morning, so thank goodness I had that egg-which sandwich and hit the gym afterwards. See you guys there. I'm being so frugal right now, guys. I'm starving. McDonald's, I had to. I was so hungry. Decided I'm just gonna eat this and then just head straight to the gym. Alright guys, we just got home. I am exhausted. I stressed myself out this morning by going to the wrong clinical site, and I think it's finally catching up to me. But we are gonna grab some ice cream with some friends after dinner. I also have to get some work done. I have honestly not figured out this whole 3rd-year workflow yet. I feel like M1 and M2, I kind of figured out how to do new content, get my work done for a small group, and just had a general flow to my days. And now that my days are all kind of different and spent in the hospital or in the clinic, I do not really know how to get my studying done. So I'm gonna do at least 20-year-old questions, get my Anki for the day done, and hopefully not fall asleep while trying to do it. And on that note, let's go get some ice cream. How was your day? 5 words or less.
11 hours long.
No.
Day was good.
Day was good.
Very good.
Very good.
5 words or less.
I'm gonna use 3. Mine are I am stupid.
No. Oh.
Hi. All right, good morning guys. Egg-which sandwich yet again. We only have 1 case today, but it is a laparoscopic hysterectomy with bilateral salpingo oophorectomy, plus a mid-urethral sling. This person has incontinence as well as a pretty severe prolapse. It'll be my first laparoscopic procedure, so might be manipulating the uterus and might even get to close some of the laparoscopic port sites. So very excited, very nervous. I have to leave here in 3 minutes, but also have to make sure I go to the right surgery center. Just waiting on my egg-which sandwich right there. All right, see you guys there. Look who I found. Alright guys, just leaving the hospital now. It's about 12 o'clock, which is super early. Probably my earliest day of third year so far. But I'm gonna use this time to go home, make some food, get my UWorld and my Anki done, hopefully be able to enjoy my evening. Like I said, the case today was a total hysterectomy with salpingo-oophorectomy, bilateral. Basically took out the uterus and the ovaries. We also did an anterior and posterior repair for prolapse. And lastly, we did a mid-urethral sling. I got to manipulate the uterus from the vagina, and I also got to close 2 port sites. So got some suturing in, assisted in the surgery even just a little bit, and now ready to go home. Alright friends, we just got home. I'm going to make some dinner. The Cavs are playing. They're down 3-1, but I believe in them. I hope we can pull it out. And I'm gonna just do some UWorld while I watch the game because I was supposed to do some UWorld earlier. I accidentally fell asleep while doing my Anki, so didn't get around to it. Hopefully I can just get like 20 or 30 questions out of the way. Alright guys, dinner. Trader Joe's gyoza. We got the game on. We're up 10. But the Pacers are on a 13-4 run, so hopefully we can hang on. Feeling nervous. Alright, well, Cavs lost. I'll see you guys in the OR tomorrow. Alright, good morning guys. I am on the way to the hospital now. Don't worry, both my hands are being used for driving or drinking my Celsius. I had to wake up pretty early, like around 5:30, because the hospital I'm going to is 45 minutes away. But we have, I think, 7 or 8 cases today. Some things I've never seen, like sacral neuromodulation placement. A company called Exonics does this along with other companies as well. But it is used to treat overactive bladder that is refractory to different medications like myrbetriq. So that'll be cool to see. And I think a couple other things I haven't seen are like some sort of urethral cyst resection. And I think there's another colpochiasis. So should be a pretty busy day. Not like yesterday, which we had 1 case for. But I will see you guys when I get there. Alright, lunchtime. We got some barbecue chips. I don't even know what I got. Chicken shawarma. Alright guys, we just got to the gym. I went home and changed quickly. And also ate a little snack, some protein granola, because that chicken shawarma wrap was just not holding me over. I also submitted evaluations for this week. Hopefully I get some responses. I've only gotten 1 response from the fellow that I worked with today, actually. So for those who don't know, most of our, I think 60% of our grade is based on evaluations and 40% is based on STEP, or not STEP, the shelf score. So evaluations and what people think of you actually matters. Alright guys, so we are now eating lunch in the break room. Today has been very fun actually. I've been able to see patients by myself, which is kind of crazy, and then present my findings to the doctor I'm working with, and he's super helpful, very enthusiastic about teaching, and it feels like I am finally able to use some of the knowledge that I've learned on this rotation so far. Gonna eat lunch. We have like 15 minutes until the next patient, so quickly scrub this down, and then we have 3 more hours to go. Alright guys, I am leaving the clinic now. Very long day, but honestly, it went pretty fast because I was actually allowed to do stuff on my own and it didn't feel like I was just shadowing for like 8 hours. So that was cool. Didn't know how to append orders by myself, so it wasn't as helpful as I maybe could have been. And my note writing was very limited because he also had a scribe. So I did more than I'm used to, but still not as much as I would like to be. Alright, we're in the gym with the boy. We both had good days in the clinic. What did they say to you? What did they say to you?
A+ for my answers.
No, they said be more confident. Be more confident. All right, post gym. Akil was roasting me for wearing these again, but I just love them so much. We're gonna grab some pizza from Good Pizza. Closes in half an hour, so hopefully we can get there in time. All right, so funny story. I went to the wrong location and the other pizza place, everyone's mad at me. The other pizza place closed at 8, so then we couldn't go there. So now we're at a different pizza place.
I have something to say to the vlog. Never ever trust this man with making plans, executing plans, or doing things, or having a good time. Give us
All right, good morning, friends. It's about 7 o'clock. Only case of the day is at 7:30. We have a interior posterior repair for prolapse, and I believe a sacrospinous fixation, so hopefully it goes well. So our case got canceled. All right, guys, the time is now 8 o'clock. What ended up happening was anesthesia did not clear the patient for surgery. They wanted her to get a TAVR, which is a procedure that minimally invasively replaces the aortic valve. I don't really know the full story, but nonetheless, will not complain about a very, very short day. Now we have didactics at 1 p.m. I might just head over to school and get some work done because Brannigan lands at the airport at like 7, so I just want to get all my work done before she gets here. All right, y'all, we are back at the old stomping grounds, heck, first floor. And sit down. I did not do any UWorld yesterday, so it's kind of a blessing that the surgical case got canceled today. Can catch up on some work. Alright, so I just got an assessment back from the attending that I worked with yesterday and was supposed to work with today. Let me show you guys. I've only gotten 2 assessments so far, but this is definitely my best one. And I'm really happy to see these positive comments.
Way.
Bye.
Bye.
Hi.
Hi.
Alright guys, we just got out of Sammy. What'd you think?
I thought it was good. It was good practice.
Yeah, I honestly think it's gonna be very helpful. So basically the setup is like a patient presents with a chief complaint. You have one student, and this is a group of like 8. You have one student go in, get a brief like HPI, do a physical exam, but the whole time like we're all working together to decide what the student is gonna ask the patient. We're working together to make a differential. The second student goes in later, they pretend that there's been like a team meeting with the attending, and they go in and tell the differential diagnosis. And then we'll chat with our team again. The facilitator gives us the diagnosis. And then the third student goes in after some research on like how you treat this, how you want to talk to the patient. The third student goes in, discusses the diagnosis, explains it to them, and then explains the treatment plan to the patient as well. So I think it's very relevant to what we do in third year. And the way they explained it is Sammy teaches you how to think, not what to know. And I think it'll be like generally applicable to everything you do in third year. All right, guys, I just got home. I'm making some food. Brannigan lands very soon, so I'm gonna end the vlog here. If you guys enjoyed it, please like and subscribe. And of course, I will see you guys in the next one.